Ambulatory M&A Advisor.
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Welcome to this webinar presented by the Ambulatory M&A Advisor. My name is Richard Romero. I'm a reporter for the publication. Today's webinar is brought to you by Ambulatory Alliances, and it is about innovative marketing programs to take your center to the next level of profitability and growth. We are lucky enough to have Ayers, VP of Corporate Development with Concentra, to be speaking with us today. So I'm going to go ahead and hand it over to Alan after I give this quick little overview. If you have any questions, you can go ahead and type them in the questions tab. I'll save them, and at the very end, I will acknowledge your question, and hopefully Alan will be able to answer it if time permits. So Alan, I'm going to go ahead and hand it over to you.
All right, great. Thank you, Richard. And thanks, everyone, for calling in. So a little bit of background about myself. I'm Vice President of Corporate Development at Concentra Urgent Care. My background, I've been with Concentra about 8 years, and prior to joining Concentra, I ran 8 urgent cares as part of a hospital joint venture, was brought into Concentra to roll out urgent care as a service to 300 formerly pure play occupational medicine clinics, and have been involved with the urgent care industry since that time. I'm on the board of directors of the Urgent Care Association of America. I'm also the practice management editor of the Journal of Urgent Care. So, Richard, if you want to advance to the next slide here, you know, the purpose of marketing in urgent care, at the end of the day, is to drive traffic through the door. And so in business school, there's a concept called the DuPont Equation, which I imagine came from DuPont Chemical Company, which basically says revenue is a function of volume and rate. And so for urgent care, your top line revenue is going to be the number of visits times your net revenue per visit. Well, there are several variables that can affect your total revenue. So your net revenue or your rate oftentimes is going to be out of your control. It may be set by a state fee schedule and workers' compensation. It may be set by insurance contracts. Related to coding, it could be set by the acuity of patient conditions coming through, or are you doing more procedures, or are you seeing more fractures, or are you seeing more sinusitis and flu shots? It can be affected by coding and documentation. Are you coding properly to capture the revenue that for the visits you're seeing? And it can also go to billing and patient collections processes. And we're seeing this particularly with the Affordable Care Act. More patients with high deductible plans, if you do not collect the patient's deductible at the time of service, it's very difficult to collect from patients afterwards. So there are ways that you can influence rate, but ultimately, a business like urgent care, because rate is often out of your control, we would say is volume driven, and that means that your top line is going to be affected by the number of visits that you see, and after a sufficient number of visits cover your fixed costs, so your rent, your utilities, your base staffing levels, each additional visit contributes to the bottom line. So the goal of marketing in urgent care clearly is to drive more visits through the door, because each incremental visit that you see should contribute more to the center's profitability. Also, the number one challenge that we hear of centers that are struggling financially, it really goes to this volume issue. If they could see more patients, seeing more patients leverages your all of your fixed costs. It improves the efficiency of your providers and staff. So clearly, urgent care is volume driven, and we need something to drive volume in urgent care. So the challenge is, and if you look at the picture here, urgent care at the high busy intersection, now open. I was involved last year in doing focus groups with consumers in a number of different cities. So we brought people in from the community, asked them their opinions of urgent care, various urgent care providers. We put the names of various urgent care providers on the board. Some of them were hospital affiliated, some of them were multi-location private equity investments, some of them were physician entrepreneurial practices. And what we found was that consumers generally view all of urgent care on an equal plane. And that poses a problem for the industry, because it means that urgent care is somewhat commoditized. People have trust in specific doctors. They have locations that they're just used to going to a specific site for urgent care services. But when it really comes to the brand, what we found is urgent care is lacking. There are very few examples of strong, well-established, differentiated brands in urgent care. So if you were to compare this to retail, I could put on a blindfold or put a blindfold on you, place you in Walmart, place you in Target, remove the blindfold, ask you what store you're in, you would clearly know the difference between a Walmart store and a Target store. Unfortunately for consumers, there are very few urgent care providers that have really achieved this level of differentiation. And so the opportunity for urgent care is to create a differentiated brand, much like you've seen in the retail space or with restaurants. I could name McDonald's, Wendy's, Starbucks, Taco Bell. Most consumers will know the differences between those brands. So we do see the opportunity in urgent care to create a differentiated brand. Now, I will say the caveat to this, we did find in our research that some hospital systems, and particularly children's hospital systems, do have a brand premium. So, when asked to kind of equate an urgent care center to a car, you throw up Colorado Children's Hospital, people will say, oh, that's the Lexus Gold Edition, because the goodwill or the brand equity for the hospital carries over to the urgent care center. But by and large, like this picture, you see generic urgent care. Urgent care is somewhat of a generic product in the eyes of many consumers. So that is both a challenge, but it's also a huge opportunity from a marketing perspective to build that differentiated brand. So the next couple slides here, and Richard, you can advance. The next couple slides, we're going to talk about a little bit about differentiation. So living in Dallas, we have two big airlines based in Dallas, Southwest and American. And the history of Southwest is really very interesting. The company's matured significantly. Now Southwest is considered a major airline, and actually some of what made Southwest unique in their culture early on, they're now, they risk losing it as they become more mainstream and start to deal with a lot of the same challenges that American and United and the others have. But I found this very interesting. Very early on, when Southwest started, they were somewhat of a struggling, fledgling startup company. The major competition in Dallas was not American. Actually, at the time, it was Braniff at Dallas-Fort Worth. And Southwest had started with 3 planes. They flew from Dallas to Houston and San Antonio. And they pretty much were known for flying oil men. And so Braniff saw Southwest as kind of a thorn in their side, and Braniff said, let's just put them under. So at the time, 1973, Braniff ran a fare sale. They were selling tickets from Dallas to Houston for $13. Southwest operating cost was $17. Southwest would normally charge $20 for the ticket. So Herb Kelleher basically looked at the scenario and said, they're going to put us out of business. If we charge $13, we'll go out of business. If we charge $20, we'll go out of business. How do we compete against Braniff, this massive airline, with all of these resources undercutting our pricing? So what Herb Kelleher said is, we're not going to reduce our price from $20 to $13. We're going to raise our price from $20 to $26. But the catch is, if you bought the $26 Dallas to Houston promotion on Southwest, you would get a free bottle of liquor. And so the picture here is, with the founder of Southwest and one of their flight attendants holding the bottle of premium liquor. Well, Southwest knew their client base. These oil men were traveling on the expense account. Yeah, they could save the company some money by taking the $13 Braniff flight, but hey, if they paid twice as much to fly Southwest, they get a free bottle of slush to take home. Well, this was hugely successful. Southwest demonstrated that by building a brand, offering something different, and being creative, they could actually charge more than the competition because they understood their customer, they understood what was driving these oil men, and as a result, Southwest survived the Great Fare War of 1973. In 1973, Southwest was actually the largest distributor of liquor in the entire state of Texas. Since that time, Southwest has had 32 consecutive years of profitability. And if you wanted to take a Braniff flight out of Dallas-Fort Worth today, you can. Good luck to you. So you see how Southwest started with the idea that they were going to be different. They were going to create a unique brand. And then as you see today, things that make Southwest different. I travel for my job every week. What airlines give you peanuts? Southwest has peanuts. They don't charge, they waive change fees. The first bag is free. And then even their passenger lounges, they thought about the needs of passengers. It's amazing to me to go into a busy airport like O'Hare and you cannot find a plug anywhere. Well, Southwest in their waiting lounges, they've redesigned the seating. They put plenty of power outlets. So clearly a differentiated product. And at one time, I guess Southwest was considered a discount airline, but more and more when I check fares in Dallas, Southwest actually gets a premium, and because of these services they offer and the brand that they've created. So it's an example of thinking outside the box and differentiating your service. Often when I see marketing for urgent care centers, I'll pick up a brochure related to urgent care, and it'll list all the services. It's interesting how urgent care centers brand themselves. So first of all, you'll see some statement like, we are convenient, affordable, accessible healthcare. That really doesn't describe urgent care. It could describe the emergency room. It could describe the minute clinic. So when you look at what differentiates an urgent care center, first of all, it's not what's important to doctors. It's actually, it's not things that patients can't see or understand. And so, when I look at marketing for urgent care centers, it's not uncommon to pick up a brochure and say, board certified, digital x-ray, something that was written from a clinical standpoint. Really, these are not the things that are most important to consumers. Now, they'll say they're important, and in these focus groups, we ask participants, how important is it to you that your physician be board certified, for instance? And they all raise their hands, oh, that's extremely important. You say, okay, well, it's very important to you to have a board certified physician. Which board do you want your physician to be a member of? And the consumers are unable to name a board. So really, differentiation goes to the things that, and then even having an electronic medical record in network, insurance providers, some of those are almost jacks to open. It would be like Southwest saying, oh, we're different because we fly, we have jet aircraft. These are not differentiators. Richard, if you advance the slide, differentiation actually goes to things that are tangible to the consumer, things that the patient can see, touch, feel, and experience. And so starting with the physical facility, oftentimes when patients go to a medical facility, they go to an urgent care for services, the patient is unskilled or untrained to evaluate the services provided by the doctor. So, they see the doctor gives the diagnosis. Is it the right diagnosis? Is it the right course of treatment? That may be subject to debate, but fact of the matter is, he is the medical doctor licensed by the state, board certified. He has the credentials to make that decision. The patient really doesn't. So what we find is that because patients can't really evaluate the effectiveness of the services provided, they look for cues in their environment to imply quality. And so we call these tangibles. When a patient comes into a medical facility, they're looking at things like how clean is the facility, what's the condition of the furnishings, fixtures, and equipment, what do the providers and staff look like, how are they dressed, what amenities are offered, is there Wi-Fi, are there power outlets, magazines, how's the seating arranged, what kind of signage is in place. It's fairly common to walk into a medical office and you see a front desk just plastered with notices as if someone's going to walk in and read everything from no cell phones allowed to you must have your insurance card to please notify us if your address has changed to not responsible for lost belongings. So, you walk into a medical facility, it's plastered, all of these signs, while the patient is going to infer quality based on their impressions of the facility. And if it's a facility that's run down, the equipment's heavily worn, there's ad hoc signage everywhere, the staff looks like they just rolled out of bed, well, clearly a good doctor wouldn't work in an environment like that. So, I mean, it actually has absolutely nothing to do with the provider, but patients will infer, they will make inferences on the quality of the provider and the quality of treatment provided based on all of these physical cues around them. So if you advance to the next slide, something that we've seen in urgent care, and urgent care really is a retail delivery model for healthcare, is focused on appealing to this consumer, we have seen urgent care centers invest fairly significantly in their facility, focusing on the environment of care, having waiting rooms that resemble a professional office or the finer homes in an area, having amenities like Wi-Fi, the coffee bar, communicating wait times. So the lower right picture here is a picture of a new Concentra center. And that was something actually, one of the first things when I was involved with rolling out urgent care within Concentra, we really had to focus on this environment of care issue. Centers that were built for occupational medicine were intended to be highly functional, highly efficient. They were often located near the employment base, which is primarily industrial. And it was, what you would see as an industrial clinic. It was fine for that purpose. But when we needed to ask patients to start coming back, not for OCMED, but for their own urgent care needs and to bring their family members, it really wasn't the type of facility that we found patients would be willing to return with their family. And so we underwent a process to relocate centers as leases came due, to renovate according to what we call signature standards, to really create the experience that would draw patients in and communicate the right messages as far as the quality of care that was being delivered. So if you flip to the next slide, in retail, there's a saying, retail is detail. And so again, not neglecting the details of your center environment, having a coffee bar, having hospitality stations, having Wi-Fi available. If you're going to have wait time, the last thing patients want to do is burn through their data plan sitting in your waiting room. And then some of it goes to retail expectations. They have Wi-Fi at Home Depot. They have Wi-Fi in Panera Bread. They have Wi-Fi on the airplane. Wi-Fi is ubiquitous. Well, when they walk into your urgent care center, they're going to expect Wi-Fi if there's going to be a wait. Having areas for children is shown here. And then this little commode, urgent care centers, the primary marketing audience has historically been the soccer mom, the main healthcare decision maker in the household. Well, I was in a Kohl's, and they were doing some construction. The men's room was shut down, so I had to go into the family or the unisex restroom. And I noticed they had the regular commodes, and they had this little commode for children. And I thought, wow, Kohl's as a retail store appeals to the exact target market that urgent care does. Kohl's appeals to women aged 25 to 54 who typically work outside the home. These would be, mothers with children, mothers that have insurance through their work, people who are concerned about time. That's your urgent care patient. Kohl's understands their customer, soccer mom, and in response, when they built their restroom, they built a restroom that would meet the needs of soccer mom. So it's really everything you do, anticipating the needs of your patients and developing your service offering around that. So if you can go to the next slide, here's a great example. Physicians Quality Care in Jackson, Tennessee. Their center is really a showplace. Now, first of all, wait times are the #1 detractor in urgent care. So ideally, you want to minimize wait. But if you end up in a situation where wait is unavoidable, Physicians Immediate Care, they have a patient concierge. So they actually employ somebody, and this can be an elderly person in the community, somebody that's social, wants to get out and interact with people. But they actually have a person that they bring into the lobby to socialize, help people, speak with people, bring people water or snacks if they've been waiting a long time. I mentioned Wi-Fi. Physicians Quality Care has multiple waiting areas. They actually have a movie theater that has popcorn. They have a slushing machine. They have a children's play area. For adults, they have a reading library, a quiet room where people can work. And so in their community, you think kids would dread going to the doctor's office. Well, you have a little cinema and popcorn and slushies. Kids, the anecdote is kids love coming here. They hear they're going to go to the doctor. Wow, that's fun. Let's go to the doctor more often. And so, when you talk about driving volume through your door, and you might be asking, I'm talking about the facility. How's this marketing? Isn't marketing advertising? No, this is marketing. This is differentiating your product in response to the needs of your consumers or understanding the expectation of your patient base. So a great example here. You want to flip to the next slide. Another form of differentiation is technology. So CareNow in Dallas-Fort Worth, they have about 26 locations. They recently sold to Hospital Corporation of America. They routinely, so I said wait times are the #1 detractor in urgent care. Well, CareNow can routinely run 3- and 4-hour wait times. But the reason why it's not a detractor and the reason why they've been able to build the powerful brand that they have is they embrace technology. So using web check-in, they built an entire service offering around the ability to pre-register, check-in online. You're going to wait from home. So ideally, when the system works correctly, they'll call you 15 minutes before the physician's ready to see you. You get in your car, drive to the center, go to the front desk, sign in, straight to the exam room, and then you ask the patient how long they waited. And if the process works like I described, they'll say they had 0 wait. They actually might have waited 2 or 3 hours, but they were waiting at home, they were waiting at the office, they could run errands, they were waiting on their own time. Now, where this system does run into challenges is if the patient pre-registers, gets to the center, and still has to wait 30 minutes, then it can become a significant detractor. But the point is, there are various mechanisms for building your brand, and CareNow built an entire brand around their web check-in, this product. Now, as far as differentiation, CareNow was one of the first to do this. At one time, I would say this was differentiation. Now there are some standard packages that include this functionality. They're going to have to think of the next rabbit to pull out of the hat to differentiate themselves. You want to go to the next slide? Differentiation can also be in the form of people. So when Concentra rolled out urgent care, as an occupational medicine provider, the culture was always focused on efficiency. It was focused on, it was a very cost-conscious culture, while realizing that we needed to appeal, we needed to not process patients through the center. We needed to provide an experience that patients would be willing to return for their own urgent care needs. We went out and said, who does customer service really well? So all your typical names, Nordstrom, Apple, Starbucks, Disney, Ritz-Carlton, they all came up. And so we started looking at, in some detail as to what differentiates these companies in terms of how they manage people. And their view is that all of their employees are marketers. So, you could take a very utilitarian view that, the role of a front desk person is to sign people in, to enter data in the computer. And if you do that, and you view your front desk person that way, you're going to devise metrics that are focused on task. Are they accurate? Are they efficient? Are they quick? What you're missing is that front desk person, probably more than anybody in the center, determines whether the center makes money. And so by that, you may have the best doctor in the world, but if someone walks in and the center's about to close in 15 minutes and the staff wants to go home, and your front desk person might end up turning someone away, or someone is trying to get directions over the phone and a front desk person who's hurt, or a front desk person who doesn't doesn't record insurance information accurately. You may see the patient, you might not get paid. So really that front desk person, probably for being the lowest paid position in the center, is probably the most influential person on determining whether patients return, whether they have a good experience. And so it's really a position that should be viewed as a marketing role. So if you look at these other organizations, they view every single encounter that a customer has with their organization as an encounter that's going to determine whether their organization thrives or loses that patient in the future. Therefore, they view every single one of their customer-facing employees as a marketing person. So if you advance here, so what's unique about healthcare, building a culture where employees have the right attitude, they really want to help patients do the right thing. Well, healthcare, we do have a leg up. If you think about it, nobody really graduates high school and says, oh, I aspire to sell khakis at the Gap. Most service industry jobs, people kind of default into. Most service industry jobs, so I'm talking retail, restaurants, hotels, they're fairly low-level, low-skilled, entry-level type positions. If you need employment, the easiest place and the quickest place you can find work is a retail store. So what we see in the service industry are these employers like Starbucks, other retail and service providers taking whoever comes through the door, and they are able to still deliver a high quality of service. Well, the inherent advantage we have in healthcare is people don't default into healthcare jobs. If you ask most people why they go into healthcare, they'll say they go into healthcare to help people. So one of the things that we found was that in the cultural transformation that we saw at Concentra, and in helping organizations, evaluate their patient service culture, a good part of it is really just unleashing employees, the frontline staff, to do what they wanted to do, what comes natural to them. Oftentimes we found that policies, procedures, which are all important. I mean, you certainly need rules to run a business, but we found employees were held back somewhat arbitrarily, and weren't always able to necessarily do the best thing for the patients. Well, when you can unleash this kind of inherent concept that people in healthcare want to help people and provide the resources and empowerment to do that, it can really make a difference in how they approach patients and how patients perceive the experience. And then the other thing, one challenge with dealing with the public in any type of position is this concept of emotional labor. So if you're in any type of customer service job, you really have to leave whatever happened at home, whatever fight you had, with your spouse before coming into the office. You have to leave all that behind and put on your game face. So there is an emotional labor of working in urgent care centers or any other type of customer service role. Sometimes it's easier to act happy than to be happy, but if you create the expectation, the culture, and help employees through role-playing understand how to interact with patients, it's almost a fake it till you make it. If you act happy, if you smile, even if you have to force yourself, over time you'll find that it comes a lot more naturally. So again, marketing, you might have thought we were going to be talking about advertising and billboards and radio, which we will, but marketing is the facility, it is the employees. And then one of the things we did at Concentra, we came up with this idea of the Orange Book. So we needed to transform the culture from one that was focused on efficiency and processing patients and moving employees, or our clients' employees, through this occupational medicine facility, to really creating an experience that patients would relate to and want to return and tell others to do likewise. So we developed the Orange Book. Not hard to understand where the concept came from. But this Orange Book really outlined the customer service expectations, and it does it through illustrations and stories. So one of the things, language, legends, stories, and heroes, in building our culture, we asked the field to identify great customer care stories, and we would evangelize those throughout the rest of the company so people could start to learn, from a practical basis, what is good service? What does good service look like? What are examples? And so the example that you see here, the individual in the purple sweater walking out to shake the patient's hand. Well, one thing early on, I would notice in the center, the MA would go to the door to the waiting room, open the door, and say, John, and then you see about 3 guys kind of look, and it takes them about 10 seconds to figure out which John it is, and then the guy goes back. And well, instead, the idea, walk out, walk out to the patient. Hello, Mr. Smith. I'm Amanda. This is my job. This is what I'm going to do today. And this is, we'd like to welcome you to the center, bring the patient back personally. It takes no extra time. It doesn't interfere with flow, but the perceptions of the patient are dramatically improved, by showing that kind of personal attention. In fact, an interesting story, when we rolled out the new customer service standards, we told the staff, that the expectation is to interact with patients, build a personal rapport. Well, we found some of our staff didn't really know what to do. They didn't know how to do that. So we said, well, I tell you what, if you don't know what to say, just tell the patient what you're doing. So if you imagine urine drug screening taking place, that could take place where the medical assistant really doesn't have to say anything. But we told the medical assistants, if you don't know how to build a rapport, just tell the patient what you're doing. So the medical assistants would kind of narrate as they were going through the urine drug screening, this is a chain of custody, and I'm writing this information on here, and this is the reason why I do this, and then on this tube I'm writing this. And as they would describe what they were doing, they were building a rapport with patients, and at the end of the day, the customer service scores just shot up because patients felt like, wow, I'm a part of the process. They care about me. I understand what's going on. My questions are being answered. So, ultimately, if you don't know what to say to patients, just talk to them. Describe what you're doing. And so it's as simple as that. So we went through a dramatic change in our culture when we first launched the service standards. Kind of back to the airline analogy. We had a net promoter score of it was less than 10. It was actually less than U.S. Airways. If you fly a lot, know the difference between airlines. When we ended the process, we had gotten it up over 50, which would actually mean we were getting better customer service feedback from Concentra patients than Southwest Airlines. So, the culture is significant to patient perceptions, and it certainly is marketing. So now kind of back to what is going to drive visits through the door. So I started with the idea that the purpose of marketing is volume, feet through the door, which will flow through to your center's bottom line. So visits in urgent care come from a number of sources. If you open an urgent care center and you're in network, you're going to see insurance referrals. If you have good signage visibility, people will see your center. They'll make a mental note every time they drive by. Should I need healthcare in the future? There's a facility I can go to. So signage is a form of marketing. Certainly repeat visits. So if you do draw a patient through the door, you need to provide the type of experience that patient is going to return. And then related to repeat visits is word of mouth. You see the pictures here of Texas Med Clinic. So Texas Med in the San Antonio area, they built about 13 centers that kind of flank the Wealth Belt, the 1604 loop. And they actually built their building as a billboard. So you see these buildings have the portico come out. It's a very clear signage. Now, in Texas, we have these very high traffic frontage roads that kind of run parallel to the freeway. Not every community set up that way. And Texas tends to be more liberal in terms of zoning. And so they were able to position these centers on the high visibility frontage road and they were able to get this highly visible signage, which you see is visible day and night, and they have a pole sign to augment it. But if you think that the freeways around San Antonio, some of them have traffic counts that are well over 100,000 cars a day. When you have a building that is basically a billboard that 100,000 cars are seeing every single day, and then you couple that with radio advertising and involvement in the community, in San Antonio, everyone knows Texas Med Clinic. I mean, they have built a differentiated brand, and part of it started with their signage, with their real estate choices. Other drivers of urgent care include paid advertising, both internet and conventional media that we'll talk about. There's Grassroots, and Grassroots should drive public relations, and then also building referral relationships with other providers in the community. And so next few slides, we'll go into more detail on these. Kind of back to signage, I do hear the question, well, just with our location, we don't have better signage options. You can certainly augment signage. Now, some communities do have different standards as far as what kind of permit you can get for temporary signage. But you see the top two pictures, Doctors Express. They're in a medical office building. They put flags out by the road, urgent care, very clear. During busy traffic hours, they have a sign flipper out there. Some communities view a sign flipper as almost protected by the First Amendment. So if you can't get other signage, you can certainly have somebody expressing their view. In this case, the view is that you should go to Doctors Express. Leveraging your facility. So the bottom left is a billboard that in St. Louis, we had a Concentra center. There was a billboard located on the back of the lot where our center sits, and there's a freeway that has about 120,000 cars a day. We got the billboard and just a very simple message, urgent care, right here, right here. And that billboard, within a couple of weeks of it going up, delivered an incremental about 11 urgent care visits a day. So it far more than paid for itself. And then even the opportunity to leverage, the municipality. We do see some areas of the country, there's municipal directional signage. It's not everywhere, but like the lower right-hand corner, there was an argument that if urgent care weren't available in the community, that people would have to drive to an adjacent community, basically to go downtown to go to the ER. So the city council decided, well, let's allow urgent care directional signage. Now, in this case, they did require the center put their hours, so it wouldn't be mistaken for a 24-hour ER. But wayfinding signage put up by the city, that may be something that, if you don't see that in your community, that may be something that you approach either your department. Most cities have either a city engineering department or a streets department, or in some areas it may have to go through the political process through, like an alderman or a town council. But certainly, what is the marketing value of municipal signage directing patients directly, to the urgent care center? Particularly in this case, the urgent care center was in a healthcare zone that was not highly visible from, the main retail drag. You go to the next slide. So, to build all of this goes to building top-of-mind awareness. So urgent care, if you look at other products that you buy, you have planned purchases and you have daily consumables. So a planned purchase would be the Ford truck. If you're going to buy a new car, there's a whole process that people follow in buying a new car. People just typically don't see an ad that says, okay, the Ford F-150, new for 2015, and they say, oh, I'm going to go buy that. And then you have daily consumables. So, those would be things like laundry detergent, soap, razor blades. Well, depending on how people use the product and how the consumer uses the product directly affects the marketing tactics used. So the challenge with urgent care is we're not a planned purchase. You don't plan on getting the flu this fall and therefore need to plan a product to deal with that situation. It's not a daily consumable. We find on average frequent users of urgent care typically use the center about twice a year. So that means it's not direct response. You can advertise. Somebody may understand, okay, I know there's an urgent care center there. I understand what they do. I just don't have an urgent care need. But when I do have the need, that's where I'm going to go. And that's really, what we would consider the top-of-mind awareness. Well, because urgent care is not a direct response, the return on marketing investment is difficult to quantify. And I have an example here that I'll demonstrate this here in a minute. So when you look at what urgent care marketing is going to accomplish, urgent care marketing is not like conventional retail marketing that we're going to run an ad that's going to draw people into the store this weekend. Urgent care marketing is intended to educate consumers and correct their misperceptions. So, and there are a lot of misperceptions about urgent care. I learned from these focus groups, there are people that thought urgent care is expensive. They thought it was for emergencies only. In areas where urgent care centers are also doing occupational medicine, a patient might have come into the facility for a drug screen and isn't even aware that there's a doctor there. They think it's a drug screening facility. Also, even the branding, some people think, oh, urgent care means zero wait. And so urgent care marketing is to educate the patients as to what the facility does, why they would go there, and to correct misperceptions around the use. And all of that must be from a patient perspective. Using vague terms like, like I mentioned, convenient, high quality, affordable, that describes any number of healthcare options. That's not really educating patients, and it's not really correcting their misperceptions. So you go to the next slide. The other thing to keep in mind with advertising is reach and frequency. So in order for advertising to be effective, you have to reach the right people, and the right people meaning those that would use urgent care, would use your center should a need occur. And then frequency is getting that message in front of the right people a sufficient number of times for it to register and build that top-of-mind awareness. So an example of reach is if you are in a, and reach can go to your tax as well. So, I have people ask about television. Is television effective for advertising urgent care? Well, if you have one urgent care center in Chicago, and the population of Chicago is like 8 million people, and you have one urgent care center, advertising on TV, one, it's going to be cost prohibitive, but assuming it weren't, you would be advertising to about 7,900,000 people who would never use your center because they don't live in the area. They may be on Medicaid. You don't take Medicaid. They don't have the right insurance. It would really be hugely inefficient to advertise a single center on television in Chicago. Now, if you're in Waco, Texas, and you have one center, and the television station pulls from a 30-mile radius, and that 30-mile radius always goes to Waco for their services, it may be more reasonable. So the point is, if you spend money to advertise to people who will never use your center, that is inefficient marketing. So you want the reach. You need to reach the right segment for your specific center. Now, generally in the United States, we see that urgent care it tends to skew more upmarket. That has to do with the urgent care being retail, and like any good retail, the urgent care growth has really been more in the suburbs of larger cities, where you have a consumer base that places a time premium on convenience. And we have seen correlations with certain demographic factors. So urgent care use is highly correlated with married families, school-age children present in the home. Children tend to be more active. They tend to pick up viruses at school. So your really conventional suburban household with above average income, employer-provided health insurance, they own their home. That's the profile of the typical urgent care patient. Now, it doesn't mean that there's not opportunity. In fact, I would say, as we've seen some suburban markets become very saturated, probably the next opportunity for urgent care is to get into the more rural and urban areas. Really, the challenge has just been Medicaid reimbursement and having a model where urgent care can be a feasible financial model in those types of markets. And as we see urgent care grow and we see greater diversity in the types of urgent care centers, we'll probably see these demographics change to start to reflect more of the demographics of the nation as a whole. And then, as I mentioned, frequency. It's not only targeting the right people, but targeting those consumers a sufficient number of times so that, when asked about an urgent care center, they can think of your center by name, by location, and should a need arise, your center will be the first place they'll think to go. And that's to accomplish this. There's no one single tactic. We get asked frequently, well, should I do billboards or should I do radio? And the two of them are actually very complementary. If you have radio ads and somebody hears the radio ad and they see your sign and they see your billboard and they got a magnet in the mail, multiple tactics all contribute to frequency, which is going to build the top-of-mind awareness. You want to go to the next slide here? So conventional advertising, so people think of marketing, they think of newspapers, billboards, radio, television. There are any number of mechanisms you can, number of ways to spend money in advertising. But grassroots marketing, we're finding, can be less expensive and more effective than paid advertising, particularly for single center operations in larger markets, and particularly when you're in a suburban area where you can really develop a relationship with the community. The challenge of paid advertising to have multiple tactics, and some media markets are extraordinarily expensive. So if you're operating in Chicago or San Francisco or other places, advertising is just extraordinarily expensive. But and then when you have to look at multiple tactics, it requires scale. For a multi-center footprint, probably not so much of an issue, but for an independent provider, having that scale can be a limitation. So considering the cost, considering that it's inefficient to reach people that are unlikely to use the center, and considering that it's difficult to measure ROI, what we've seen is that we've seen a great deal of success in focusing on grassroots type tactics. And grassroots, there are a lot of advantages to that. You get out in the community, people say, hey, I'm part of this community, I'm loyal to the community, and people like to stick, with providers that are close to home. So grassroots reaches people in the community where they live, work, and play. It demonstrates a commitment to the community by getting involved with schools, churches. It shows, if you consider what's important to your patient base, and you ask them what's important, what's important to you. My kids are important to me. My church is important to me. Grassroots really shows the patient that what is important to them is important to us. And there's a powerful message that goes behind that. And if done correctly, it can also enable business relationships that'll drive occupational medicine. It can strengthen referral relationships with other providers. And certainly, where done correctly, it spurs word of mouth and creates buzz. To get others doing your marketing, that face-to-face kind of word of mouth is invaluable. So this slide here has a list of various ways to become engaged with the community. A couple pictures here. Clearly, if you have a news center having a grand opening, getting the mayor, the Chamber of Commerce, I think any politician will show up for a photo op, and particularly if it's a photo op that has to do with adding jobs or contributing to the local economy. Take advantage of these opportunities. So you see here a grand opening that they have the center team, they have the politicians, they have the cheerleaders. The one on the bottom, people think this is a graveyard. They're actually ice sculptures. But Warren Urgent Care. So Warren is a suburb of Detroit. The largest employer is General Motors, the GM Tech Center's there. And Warren Urgent Care, they basically went to the city of Warren and said, for $10,000, we will be the exclusive sponsor of all parks and recreation activities. So the city of Warren, in the wintertime, they have an ice skating rink outside. They have these ice sculptures that people come and see, and they're right there is Warren Urgent Care as their banner. In the summertime, their banner's out at the baseball fields. Also in the winter, there's a large kind of indoor municipal water park type facility, an indoor pool that has water slides, and there's a gym. Warren Urgent Care has their banner in there. What a great investment. $10,000 to be wherever people in the community are showing up for these municipal activities. And that money isn't going to, it's not going to CBS or NBC or some large media conglomerate. It's actually going to the city, so that Warren's going to take that $10,000 and use it to invest in parks and recreation, which is going to benefit the members of the community. So, you can refer to this later on, but here's some examples of various grassroots activities, and then I'll dive into some of these if you advance the slide. Dive into some of these in a little more detail. Center pre-opening. So certainly taking advantage of your location. When's the time to start marketing? Time to start marketing is actually to create buzz before your center opens. Now certainly, as a new building goes up, and I actually saw a very creative approach, a restaurant, they were building a new restaurant near where I live in Dallas, and so when the construction started, the restaurant put a sign out there before they put their own sign. They put a sign that says, "Can you guess what's coming here?" And so, it's almost, the mom driving by with the kid in the front seat, they have a guessing game. Well, what's it going to be? What's it going to be? And then there's this anticipation. Well, when the sign, finally came up that what the restaurant was, they may have been disappointed, but certainly they're going to remember that the restaurant was going into place there. So building buzz that the center is opening, taking advantage of signage to call attention to the new facility. Advance to the next slide. If you want to advance the slide, there we go. Taking advantage of the grand opening, even so, the example that I showed a minute ago, this was a FastMed center here in Mesa, Arizona. They brought out the police. They had free pizza to draw people out and off the street. They had face painting. They engaged with other vendors. So LA Fitness is always looking to sell memberships. You can co-opt with a vendor like that. Tell LA Fitness, hey, we'll let you come to our grand opening if you let us set up on a busy Wednesday night in your health club during flu season to talk to people about flu shots and urgent care. So it goes to building relationships with the community, through police, fire, schools, other vendors, and then just raising awareness, having an event to draw people in off the street. And this doesn't have to be for a grand opening. A perfect time for this, if you have a good retail position, is back to school. When soccer mom in August is out there, looking to buy new clothes for the kids and buy school supplies, they're out and about. You drive by this place and there's a bouncy house and face painting and free pizza. You just draw people in off the street, and it provides you a face-to-face opportunity to educate that patient as to what your center does, why they would go there. They can become familiar with the staff and the providers, and the cost of this, it can actually be very low. In fact, I've seen centers that will have a open house, They can get pharmaceutical reps to contribute some of the food. Staff, oftentimes, family members, you have to run, and you do have to be mindful of wage and hour laws, but oftentimes you can get staff engaged and volunteering for these types of activities, and then co-opting with others in the community. For relatively low cost, you can make a pretty high impact, and it provides a face-to-face interaction, which is going to be far more memorable than somebody receiving something in the mail. Personally for me, anything that comes in the mail, I stop by my garage, and if it's important, it goes in the house. More than likely, it's going to go in the recycling bin. So, these types of activities, and here's a slide, an example of a center open house. This was Physicians Immediate Care in Chicago. They had giveaways, the cup of soup with the coffee cup. They had the staff, the medical assistants demonstrating the services. They brought in a massage therapist, free massage. And so, again, it's going to be far more memorable, this type of one-on-one interaction than most kind of one-time media exposure. You go to the next slide. Value of a mascot. So this is something, Healthcare Express they're based in Texarkana, and they have a number of centers in Texas, Arkansas, and Oklahoma. And so when I'm asked who does grassroots marketing extraordinarily well, I would say Healthcare Express is one that does grassroots extraordinarily well. And they embrace the concept of a mascot. Well, I've spoken with doctors that say, mascot, that's not medicine, that's not professional, that's not quality, that's corny. Well, tell you what a mascot will do. A mascot will get you into any venue that has kids. So if you don't have a mascot, and I tell you to go do grassroots, and you go to the Mother's Day Out, or you go to the elementary school, or you go to the church, and say, oh, we want to tell people about urgent care, they would say, well, why would we let you do that? But if you have a mascot, you can use the mascot to get into community events, having the mascot show up at the high school football game, getting involved with schools, having the mascot go in. They actually have children, like summer reading programs where the kids can read to the mascot. The mascot provides photo opportunities, so coupling the mascot with social media to have an event where you take pictures with the mascot and then hand out a card saying, if you want this picture, send us your email address. Well, then you've not only provided something memorable to somebody in the community, but now you have their contact information, so you can add them to your email newsletter list. So the mascot is really significant in getting, building a brand and getting into the types of venues. And it's something that, a center can be known for, is their mascot. It's certainly part of their branding. In fact, there's some interesting stories. Tina Bader-Bell set up this program with Healthcare Express, and she's no longer in urgent care, but she was very innovative, and some of the ideas that they would do, the mascot would go shopping at Target. There's nothing to prevent you from wearing an animal outfit in Target, and so long as they buy something, the mascot would go to Starbucks. Well, when this mascot was just doing things in the community, clearly with a handler, because I don't know how well you can see in that outfit. But having the mascot out and about in the community draws attention. So in the Target, you would think the manager at Target, a lot of people don't even want to try stuff. They say, oh, why would Target let our mascot in there? Hey, the manager at Target wants people in the store to have a good experience and to stay longer. And if you have a furry mascot walking through the store and the customers like it and they call attention to it, store manager is not going to mind. And actually, you do have a right to be in public, places, regardless of how you dress, so long as you're, so long as you actually buy something. So anyway, the idea of this mascot being known in the community, being visible in the community, showing up at random places, they built an entire marketing tactic around that. Sports physicals, with back to school, this is a common promotion that we see centers doing. The one thing I would point out on this, some centers do give away free physicals. I've actually found from my own experience, and we've piloted things across Concentra's footprint, we found that it's actually better to charge for the physical and then either have some type of rebate or give back program to the school. So, we'll have a coupon. If you bring this coupon in for a sports physical is going to be $25, but we will donate $5 or $10 of that to your school. Well, then by co-opting the school, when the question gets asked to the high school athletic director, oh, where do I go for a sports physical? If the high school, and every school is in need of funds, you can actually get the school doing your marketing. Oh, your kid needs a physical. Here's the flyer. It couldn't be a more clear marketing message than this one from the little clinic. Then you're actually getting other people in the community to refer back to your center. Now, the issue with free physicals, what we found with free physicals is they basically draw people looking for something for free. And so we ran a free sports physical in a fairly large city in the Midwest. When we tracked where patients were coming from, we were seeing 3 or 4 patients from the same inner city apartment complex, or 3 or 4 patients from unique households that were like 40 miles away in the country. They basically heard something free. They went to the clinic for something free. Those patients aren't coming back. They got what they were looking for free. And then even the patients we found from the surrounding communities, the perception of a free physical was actually negative. So you would think kind of intuitively, oh, you use the free physical to draw someone in, but look at it this way. Your child's very important to you. Sure, you're willing to have someone fill out a form for the school for free, but if your kid gets hurt, you're not going to send them to the free doctor. You're going to send them to the ER because they charge a lot. That means they're really good. And so that's kind of the consumer perception. So we did find it's always better to charge for sports physicals, even if you establish a program to rebate some of that, some of those funds through a donation back to the school or another charity. And then lastly, with sports physicals, we talked about differentiation. Well, let's say everyone in your community is doing sports physicals, and this may be a commodity product now because the retail clinics do it. I've even seen chiropractic offices offering high school sports physicals. Well, there are ways to differentiate it. So this issue of sudden cardiac death has kind of gotten some headlines. So, what if you add an EKG to your physical? Right Time in Maryland, that may be a website that you choose to check out. Right Time Medical Center, they built an entire sports physical, and they don't call them physicals. They call them participation exams or something like that. But they built an entire service around the fact that they offer concussion testing. Concussions in certain sports have become very high profile. And the fact that they provide this baseline concussion testing, basically what they're saying is if your child suffers a traumatic brain injury later in the season, they can go back, look at the baseline, and determine the extent of brain injury that occurred. It's something you would hope would never happen, but providing that service gives assurance to the parents. It creates brand differentiation, it creates word of mouth, and it actually demonstrates a higher quality product than just saying, we'll fill out the form for the high school. Advance to the next slide. Event participation, so Grassroots, you certainly want to be out in the community. Now, I like these pictures. This was a Oktoberfest, I believe, in Addison, Texas. So Great Star is an apartment company. And so they showed up, and they had a tent, and they had a banner, and they had marketing collateral. But look at the people in the booth. They got the team out to sit in the booth and talk to one another. There's nothing inviting about that. So they may have thought, wow, we went to this event and there were 20,000 people there, and yeah, but they didn't really get much exposure because the people there were all talking to themselves. If you're going to show up and do it correctly. And so the keys to event participation, you need the right location for your booth, certainly capturing the foot traffic coming by. You need something to draw people to your booth. You need to share the message face-to-face. So the reason why you get out in the community, you don't get out in the community so people can see your banner. You get out in the community so you can talk to people one-on-one about your center so they can meet your staff, meet your providers, and, again, create a memorable experience so when they have an urgent care need, it becomes top of mind. And then some meaningful takeaway. So if you go to the next slide, one thing I noticed, and this is an Irish festival that was in my hometown, wherever you saw a prize wheel, people were lining up. And so you see Chase Bank, IGS is a gas company, you see Channel 10 News, all of them have a prize wheel. People see a prize wheel. It doesn't even matter what they're spinning the wheel for. People will line up for a prize wheel. So you think about it this way. You're going to show, so thinking of the previous slide, you have giveaways, you have people there, you have a booth. To do it correctly, if Chase is going to be giving away little trinkets, pins, keychains, frisbees, whatever trinkets they're giving away anyway, set up the prize wheel, make it engaging, make it fun, make it an experience that people will remember. So if you advance to the next slide, certainly, engaging people through games. This is an example, MedExpress. This was behind a Rita's. Rita's is a frozen, they're Italian ice drink. And so, in the Northeast, in the hot, muggy summer months, people love to get out. They're going to go get their Italian ice. Well, MedExpress is there. Hey, come over. We have this Plinko game, and maybe you can win something. And it just makes it fun. It makes people interesting, because if you didn't have the prize wheel, it's kind of like the Mascot. Why would Rita's, if you went to Rita's and said, oh, we need to talk to people about urgent care and clinical, they say, well, why would we let you do that? But you make it fun, you make it engaging, and then by making it fun and engaging, you can also get your staff and providers involved with the activities as well. If you go to the next slide here, and I'm cognizant that we're approaching the end. Building referral relationships is another source. The one thing I would say about referral relationships is it really has to be a one-to-one relationship, typically provider to provider. So you can't send an operations or a marketing person to go build relationships with other providers. The primary care doc needs to have assurance that, one, if their patient goes to urgent care, we're not going to steal their patient. We don't intend to steal their patient. That we're going to work with the primary care provider. And in most cases, I would say most primary care doctors are curious enough, or at least just for professional, for professional courtesy, you can draw them out to a breakfast meeting. If you meet at a Bob Evans or a Denny's, 7 a.m., their office opens at 8:30. You can typically draw them out, have a face-to-face meeting, kind of explain what you're looking to do. Well, the next thing, other providers can be an incredible source of referrals. Now, primary care is migrating towards larger groups, and that can provide some complications. But in many cases, you still have independent providers, and they take the 2-week vacation in August, and their office is closed at lunch, and their office closes at 5 p.m. And so that provider, realizing that if you're going to collaborate with them, may be willing to direct people to your center. And, while we talk about this in regards to primary care, the same concepts can apply to retail health centers, campus student health centers, and even certain specialists. OBGYN physicians typically act as many women's primary care, but if it's something not involving the fetus, they're busy. They probably don't want to be. They don't necessarily want to be bothered. So, to have some place that they can send their patients where they know there's going to be follow-up, a good level of care. But, as I mentioned, the relationship always starts with the provider. Even the retail health clinics, if you approach, like a CVS corporate will say, well, we have a hospital partner, we have a structured process for that. You're probably not going to make much headway. Well, the nurse practitioner sitting in CVS, that is a 100 square foot clinic. There's no exam table, no imaging, very limited, very protocol-driven services. That nurse practitioner needs to know where to send lacerations and x-rays and workers' comp and things that she can't treat, even if the company says you're supposed to send them to our affiliated hospital's emergency room. It's not uncommon if you build a good relationship with nurse practitioners in the retail clinic or the front office at the emergency room. They'll tell patients, well, some people are going over to this urgent care center and they can probably help you out, and there'll be a short wait. So it's again, building relationships, but it really starts in most cases, in particular with other providers, it starts with the provider. You want to advance to the next slide? And then, the communication, again, so when a patient comes in, referring the chart back with the patient's permission. Some patients actually choose urgent care because it's somewhat anonymous, or there's certain things they may not want their primary care doctor to know. Certainly the patient needs to have some control on that, and that goes to HIPAA as well. Advance to the next slide, please. So here's an example, integrated marketing plan. Everything that we talked about, you're going to pull it all together. There is no one silver bullet. It depends on your center. It depends on the community. But essentially, you're going to have a mix: paid advertising, community grassroots, provider referrals, and then using your center as a marketing tool. And in-center collateral, in addition to the experience you provide in your facility, you have somewhat of a captive audience. So I would look at it this way. When I took over and launched urgent care within Concentra, we had a lot of outside marketing materials. Like I would walk in and I would see the ads for, here are discount coupons for Gold's Gym, here's a free pharmacy discount card, here's something from the drug company. I said, why do we have everyone else's crap in our waiting room? Look at it this way. Concentra, over the course of a year, every single day, Concentra sees 30,000 patients. And they're captive in our waiting room. Well, if I were to go to a sports venue like the ballpark in Arlington, Texas, that seats about 22,000 people. You go to the ballpark in Arlington, you see Southwest Airlines, you see Budweiser, you see the Ford, these big advertising. They are paying big bucks to get in front of those 22,000 people sitting in the stadium. Why do doctors allow people off the street to set stuff up in their waiting room for free? If you're going to market anything, use it for your own marketing. Southwest Airlines doesn't go to the ballpark in Arlington and say, hey, we'll give you a free billboard if you let us have our sign in your ballpark. They would never buy that. But doctors buy it all the time. I walk in, I see TV screens, I see all this stuff that has their outside entities. So I would say looking in your exam rooms, looking in your waiting room, anything that is not promoting your business should go out, just go in the trash, and then look at ways that you can use that to promote other services. So, if you have people sitting in your waiting room, the ability to inform patients, well, we also offer, we're seeing urgent care centers diversify beyond the episodic walk-in. We also offer flu shots. We also offer sports physicals. We also offer aesthetic services or smoking cessation or weight loss or whatever it is. You have a captive audience in your center every day. You should be using your marketing resources to increase the utilization. And increasing utilization, again, goes back to where we started with driving volume. Go to the next slide, please. Urgent care seasonality. So the question comes up, when are you going to market urgent care? And so think of this in terms of retail. If I were to ask the busiest shopping day of the year, you would say Black Friday. If you were going to advertise a store or open a new store, you wouldn't open it on Black Friday because people already know their Black Friday plans weeks in advance. In fact, that would probably be the worst time to open or advertise a retail store. So you really have to anticipate when people are going to need urgent care services, and then you advertise to start building top of mind into that. So this chart shows the busiest season, and there is some differences in seasonality. So I compare here a center, or this was actually a group of like 26 centers in Florida compared to a group of like 10 centers in the Midwest. You do see that Florida has some exaggerated seasonality around spring break. There's some exaggerated seasonality around back to school. So, people typically don't go take their kids to Disney the week school starts back where they come from. But by and large, the seasonality curve for urgent care, it's going to be busiest in the winter months. So that means when you start marketing, you need to start marketing 3 or 4 months ahead of your busy season to build that top of mind awareness. And I would say it typically starts with back to school, which is why the back to school promotions, like I mentioned, the open house, the sports physicals, that's why those are so valuable, because it's kind of the kickoff to your marketing season. You would start your marketing, around August, September, back to school, increase your marketing spend up into the busy season, and then you wouldn't want to go dark with marketing during the summer months, but you would probably have a change. So if you were doing more conventional advertising in the winter, summer is going to be your opportunity to get out, do your grassroots, because that's when most communities are going to have their, their festivals, their parades, their balloon fest, 4th of July, art fair, whatever it is that's big in your community. And then the other thing is the number one predictor of volume during the off-peak season is foot traffic during the peak season. If there's anybody who is starting a new urgent care center, typically we see urgent care operators say, oh, I'm going to, it's a new tax year, I'm going to leave my job at the ER, open my new center January 1st, and it's a new year, new tax, clean start. January is probably the absolute worst time to open an urgent care center, because what happens from a marketing perspective is you open in January, you have insufficient time during the busy season to build that top of mind awareness, and then by the time people learn your center's there, you're in the summer when people have less need for urgent care. Basically what we see as a January opening loses almost an entire year of volume building. if your lead starts January 1, in many cases you may be better off not holding off until July or August to actually open the center, because otherwise you'd be operating at a loss, or at least you want to open it with a skeleton crew until until you get to where your business kind of aligns with consumer utilization. And go to the next slide, please. Direct response versus brand building. So this is the idea. Kohl's can run a coupon. Kohl's can advertise things in the circular. They can calculate an ROI based on how many coupons were redeemed. We advertised, this specific outfit. This is how many of the outfits we sold. You can tie advertising directly to sales. I would say urgent care is really more brand building. Ford advertises the F-150. Kind of at a macro level, you can correlate advertising to car sales, but it's not a one-to-one relationship. People don't, it's not like seeing the coupon for Kohl's. Oh, I got to use this thing by Saturday. Oh, F-150, I need to pick that thing up, now. It's a different process. And so because of this, because there's not really a direct response in urgent care, and there's some exceptions. If you run a coupon promotion for sports physicals or flu shots, yeah, that gives you a direct response. But by and large, urgent care advertising is really focused on building the brand. And so you go to the next slide. This shows some ROI calculations. ROI is very difficult to calculate in urgent care for that reason. And as a result, many urgent care operators, you should look at ROI, but they also look at other measures. So, you go to a community event and you have the prize wheel and you're collecting email addresses. A measure can be how many email addresses did you get? How many good email addresses did you get? How many names are on your mailing list? How many likes do you have on your Facebook page? How many hits on your website? So all of these other types of measures can be proxies for really, lack of clarity around a true ROI around urgent care marketing. Can you go to the next slide, please? So I included some things in the appendix, and I apologize, we did run over slightly here, so I won't cover those. I will now open the call to any questions that you might have.
So far, I am not seeing any questions popping up on our screen. So would you like to wrap it up here? All right.
Actually, I see one here. So it says, in my area, I have noticed that HCA has begun opening urgent cares that are branded with the local brand of their local regional hospital hubs. Okay, so that's probably more of a statement than a question, and that is correct. We are seeing that hospitals are increasingly getting into the urgent care business. There are pros and cons to that. Some hospital urgent care centers charge facility fees. They run it somewhat like an ER versus a true walk-in model. That can be misleading to the public. We see in some cases the hospital is willing to open an urgent care center as a loss leader, so provided that urgent care center can turn off downstream referrals, imaging, specialist referrals, PT, other services to the hospital is willing to operate the urgent care center itself in a loss. Now, hospitals will kind of wax and wane as to their appetite for operating losses. The challenge is if you have a community that's overbuilt in urgent care, and you ask who's going to survive, the hospital has the deepest pockets. The hospital doesn't necessarily have to make money at the point of service. It does give the hospital an advantage. And then in some cases, we are seeing hospitals using the urgent care as to build a brand and to expand in areas where the hospital doesn't currently have a presence, and we see a brand halo associated with that. So when you ask about quality, people will say, oh, the Cleveland Clinic has a great reputation for quality. If the Cleveland Clinic were to have an urgent care, and they currently don't in Cleveland, but if they did, consumers are naturally going to assume the Cleveland Clinic is a higher quality urgent care than perhaps another brand, although those perceptions are not necessarily accurate. So we are seeing that activity among hospitals, and I imagine that as hospitals with the Affordable Care Act, and as hospitals look, hospitals start to build these local monopolies that are tied into accountable care, I would expect, as you mentioned with HCA, tenants doing the exact same thing through MedPost, that we will see more urgent care activity by local regional hospitals as well as the national companies like HCA and Tenet.
All right. Well, thank you, Ellen, for speaking with us today. You've just been in tune to our webinar about grassroots marketing and maximizing the value of your urgent care center physically. My name is Richard Romero. I'm with the Ambulatory M&A Advisor. You can visit us at www.ambulatoryadvisor.com. If you missed any of this information, I will have some articles out early next week. And also for the person who asked the question about the HCA and the hubs, we also have an article online that was recently written about that. So once again, www.ambulatoryadvisor.com. I'm Richard Romero. You guys have a great day. Thank you.